Welcome back to the Morning Blend. Every year, more than 140,000 folks are diagnosed with colon cancer and more than 50,000 people die. The good news, this cancer can be treated and even prevented if caught early. Here to show us how we can fight back, Dr. Jud Fisher with Healthcare Partners. Good morning and nice to see you again.
Nice to see you again, Dao.
Tell us, what exactly is colorectal cancer?
Colorectal cancer is a change in the cells of the lining of the colon and rectum that eventually becomes cancerous. These cells begin growing uninhibited, and initially for most forms form what we call polyps. And these polyps are what generally lead to cancer, and they are called precancerous in the earliest stage.
Do these polyps develop rapidly, or is it slow, or just depends?
Generally, for most, rather slow development, and that's the concept of us really pushing colonoscopy as a screening tool being a mechanism by which we can find things in patients before symptoms exist.
So screening is very important in detecting this disease.
Yes, it is.
And who should be getting screened, and how often should people be getting screened?
For the basic population, those that aren't at high risk, the general population, the key age is age 50. And we want people to start being screened at age 50 and then a minimum of every 10 years, depending on their change in clinical situation or symptoms. If they started having rectal bleeding or other problems, obviously we would change that. Or if we found a large number of precancerous polyps on their initial screening, it would change the next time that they see their gastroenterologist.
So how effective would you say the screening is in detecting this?
This is a very exciting thing, although it's a test most people don't want to think about and talk about. It's a part of the body that most humans don't want to really discuss. However, the key is if we can find these polyps at the early stage when they are precancerous, we not only are diagnosing a potential problem down the road, but the gastroenterologist at the same time that the colonoscopy is done can remove those precancerous polyps, therefore actually preventing further disease and cancerous change.
And people are watching right now and thinking, are there any ways to prevent this from happening in the first place?
Well, as with many things that we try to push in terms of health orientation, a good lifestyle helps. Reducing red meat consumption, reducing alcohol intake, having a good healthy lifestyle that includes at least 30 minutes of exercise 5 times per week, avoidance of, not avoidance, but actually pushing high fiber diet, fruits and vegetables. These things all contribute to the healthier lifestyle that helps ward off colon cancer.
And if someone needs to get this procedure done, how safe would you say it is?
The incidence of complications from colonoscopy is exceedingly low, and without a doubt the benefits far outweigh any risk. We have 50,000 people per year dying from colon cancer, and it is something that is highly preventable when we do appropriate screening. If we could get more people screened, the incidence of colon cancer deaths would go down dramatically in this country.
And how long does a procedure typically take, and what do we need to prepare? How do we prepare?
Typical preparation for the colonoscopy will be that the patient will take a liquid laxative the night before to clean out the colon so that the endoscopist can get a good view with the colonoscope as they're looking at the inside lining of the colon and the rectum. The procedure then typically takes 20 to 30 minutes, and the patients generally have little or no discomfort whatsoever. They are given a sedative. This is not general anesthesia. This is sedation. And most of my patients that have had it done don't even recall having it done. The procedure is over and they're ready to be taken home by their family or friends. They cannot drive after the procedure.
Are you asleep when the procedure happens, or you're fully awake?
Well, it's sedation.
Yeah.
When we talk about asleep, oftentimes patients think of general anesthesia where you're completely out. This is sedation. You're sedated and being monitored by an anesthesiologist. And you have the endoscopist doing the procedure, and generally there is no recollection whatsoever of the procedure.
Yeah, people fear pain, they fear going to the doctor, but it's so important to get it done, and it could save your life.
Very much so. Very much
Any
so.
other advice or tips you want to give people to either that are going through this or to prevent it?
This is an amazingly preventable, treatable disease state when caught early, as with many cancers. And remember that it's for you, it's for your loved ones, it's so that you can hopefully these patients will be able to see their grandchildren graduate from college as opposed to having a bad outcome. And we want everyone to be screened after the age of 50, and for certain at-risk groups, maybe even sooner. If there's family history of colon cancer, we may start the screening up to 10 years sooner based on when your direct family member had cancer. If your father had colon cancer at age 45, we would even start screening those patients at age 35, 10 years prior.
So important to go see your doctor, and the doctor will make all the recommendations necessary for you. So
yes,
important to do that. Thank you so much, Dr. Fisher.
Thank you.
Appreciate it. For more information on colon cancer, check out the website on your screen. Dr. Fisher's office is located on North Nellis Boulevard. Sean, over to you.
Thank you so much, Dao.